In terms of the Apgar score, the correlation improves if the low score is persisting at or beyond 10 minutes. Thankfully, it's not very common. The factors, it may be affected non-specific factors like prematurity, infection, congenital pre-existing problems, and neurological disorders. So the same reason the baby is floppy due to a brain disorder or a myopathy, the baby may not respond to resuscitation as well. It can be useful as an indicator of response to resuscitation and the adequacy of resuscitation measures. And it's very important to use the full range of the Apgar scores. You should categorize why you are scoring it when you document, so that in future, if there is any review, it will be clear. The blood gas levels have been used to monitor the fetal state in addition to the CTG since 1967, and metabolic or mixed acidosis is more significant. The neurologic outcome can be correlated with the severity and duration of acidosis, especially if the pH is below 7. There are, however, many babies who have a normal outcome below a pH of 7. So this is Goodwin et al.'s data, which clearly shows that when the pH is 6.9 to 6.99, only 12% of the babies have HAE. And if you have 6.8 to 6.89, 33%, 6.7 to 6.79. So this is a very low pH really. Even there, not all babies develop HAE. And as you go down, then the risk of multi-system involvement happens as well, because it's a persistent acidosis and it affects all the organs. So the correlation, the diving reflex doesn't protect beyond a certain time, because it's an indication of how long the asphyxia has persisted.